Okay, my name is Amanda Harris. Today I'm doing the video competency for initiation of NIV. So first thing you want to do is go over the patient's charts, verify the doctor's orders. You're going to perform proper hand hygiene. Okay. Hello, my name is Amanda. I'm a respiratory therapist. Can you please verify your name and date of birth? All right, thank you, Mr. Wilson. Well, your doctor's ordered you to be put on the non-invasive ventilator. It's not a big deal. We're just going to put a mask over you, and it's going to help you breathe. It's going to give you some pressure to keep your lungs open, get oxygenation better for you. The first thing I want to do is I'm going to go ahead and size your mask, so we have that ready. I'm going to put this on the bridge, put on the bridge of their nose, and then just below their mouth, and have them open their mouth. So it looks like he's a medium. So at this point, we'll get our equipment ready. Now I'm going to go on over to the ventilator. So you would make sure you got your oxygen hooked up and make sure it's plugged in. Turn it on from behind the machine. All right. The first thing we're going to do is the test port leak. So start it here. And then you're going to occlude the top of this, leaving the port open. Alright, so now the test has been completed, so we're going to go ahead and set. We're supposed to put the patient on a 5 centimeters of water pressure, CPAP. So we set that to 5. So then we go over here and it's 100% FiO2. It's already on that. Next we go to our alarms. For the pressure, we're going to set 2 above and 2 below. So for 5, that would be a 7 and a 3. We're going to keep a delay pressure low for 20 and the apnea for 20. The minute ventilation is actually going to go on what the patient's doing. It's going to be 20%. Your high rate, we would do a 30, and the low is a 12. So right now, I'm going to go ahead and up that a little so it's not going off while I'm getting the patient hooked up. So at this point, we would go ahead and get the flow going and put the mask on the patient. So we're going to pretend we got the flow to the mask. Alright, so with these, you're better off to have them about ready to go so you can easily slip them over the patient's head and make sure they look in order so you're not fumbling around. Alright, bear with me here. We're going to put this over your face. Mind you, there is flow going to it for patient safety. We want the mask to be tight, but not too tight to where it's uncomfortable, but we need to watch the leak. Alright, so how does that feel? Alright, just a little bit more time here. Okay, it's looking pretty good. So we come back over here to our alarms. The minute ventilation is running at a 9. So I'm going to set this to a 20%. Let's go down to about I'm going to go 3. All right. Alrighty. And then we have this all set up on the patient. The next thing that you want to do is assess your patient. You want to check their SPO, their heart rate, just generally make sure everything's going okay. Then you go back and document this in the patient's charts, and you tell the nurses and stuff what's going on. And then, of course, perform proper hand hygiene as you exit the room.